Good evening, everyone. Is it audible?
Good evening, sir. Yes,
And the screen is also visible, right?
yes, sir. Both are.
Okay. So today's class is the legal foundation of modern healthcare, understanding legal requirements in healthcare, learning some of the cases in non-profit organizations, and support of international agencies, as well as handling of emergency medicines. Handling this agenda for today. Begin with, we have introduction to healthcare, legal framework, purpose and scope of medical laws, patient rights and organizational responsibilities, legal challenges in global and emergency healthcare, case studies of Mayo Clinic, Feeding America, and Red Cross. Apart from that, we also have community health and welfare legal frameworks, global philanthropy, regulatory compliance, healthcare funding and transparency, legal aspects of partnerships and collaborations, employment laws in healthcare organizations. The key takeaways could be risk management and emerging legal trends, compliance as a driver of quality and trust, ethical governance in healthcare systems, as well as building sustainable and legally compliant healthcare systems. To begin with, the introduction covers about the legal requirements of healthcare. Healthcare operates within a structured legal environment designed to ensure patient safety and to uphold ethical practices and maintain the professional accountability. Legal requirements are applicable to all types of healthcare providers, public, private, as well as non-profit organizations. It is compulsory to make compliances. These laws establish clear rules for operations of hospitals, clinics, as well as global healthcare organizations. In international healthcare, additional legal obligations arise from global health regulations, treaties, and cross border agreements, which further increase the complexity of compliance. Understanding these legal foundations is essential for healthcare professionals, administrators, and learners to appreciate the importance of lawful and ethical healthcare delivery. Legal frameworks serves as a backbone of trust in healthcare systems, ensuring consistency, safety, and transparency across all levels of service. So, why healthcare laws exist and why? What do they cover? So, the architecture of trust nowadays, even the healthcare as well as legal compliance is assisted by technology, where some of the people are having engineering patient safety across domestic laws, along with the global humanitarian aid, as well as autonomous algorithms, which are assisting in compliances. The purpose and the scope of medical laws is at the core, they have to protect the patients from harm, from negligence, and from unethical practices prevailing at different parts of the world. By setting the minimum standards of care, these laws should ensure that healthcare providers deliver services safely and consistently. Healthcare regulations also govern the professional conduct, prevent fraudulent practices, and promote responsible use of medical resources. Though enforcement of accountability and laws trust among patients, medical practitioners, and healthcare institutions ensure that healthcare services are delivered reliably and responsibly. The scope of healthcare regulations is extensive. They cover licensing, credentialing of medical professionals, ensuring competence, accreditation of healthcare institutions to maintain quality standards, and regulation of medical practices also to prevent malpractice. So, consent laws require that patients are fully informed about the treatments and actively participate in the decision making process. Data protection and privacy laws also have been recently added so that the patient health information against any unauthorized access or misuse is prevented. Additionally, pharmaceutical and medical devices regulations also ensure that the medicines and equipments are safe and are effective and are ethically distributed to the needy as well. Together, these legal frameworks create a comprehensive systems that protect both the patients and the providers of healthcare. The domestic laws at various countries establishes the baseline infrastructure for patient safety. So some of the case studies which you have come across ensures that the patient consent is first taken. Informed consent laws empower the patient. They ensure that they receive the accurate diagnosis and treatment options before participating in any medical decisions. Apart from that, the data privacy is of utmost importance. Data protection against regulation and sensitive patient health information should not be leaked to insurance companies or any other organizations. Institutional duty, it is to ensure that legal environment is being complied with and is designed to ensure the safe facilities and uphold the ethical practices and maintain strict professional accountability. And professional licensing, those who are able to take care only have to be allowed. Licensing and credentialing laws has become even more important these days to guarantee the competence of medical professionals. So patient safety as well as the provider safety is of utmost importance for domestic laws in any country. Patient rights and ethical standards. So, patient rights are central to healthcare legislation. Laws guarantee the patient receive the clear and accurate information regarding the diagnosis. So, what type of options are before the patients? What are the potential risks involved? All that has to be transparent. Privacy and confidentiality protections should always prevent misuse of sensitive health information. Patients are entitled to equal treatment without any discrimination on the basis of gender, age, ethnicity, religion, or socioeconomic status. They also have the right to file the complaints and to seek the legal recourse if the standards of care are not met. These rights empower the patients and foster trust and promote ethical conduct, and they are going to have the same kind of conduct amongst the healthcare providers. Organization responsibilities for the clinics or hospitals and any kind of centers, they have to be very specific in performing their legal duties. They are required to maintain safe facilities, hire qualified staff, ensure accurate record keeping. Public health reporting obligations such as notifying the authorities of communicable diseases are mandatory. Organizations are legally accountable for the actions of the employees while delivering the care. So, non compliance may result in litigation, financial penalties, and revocation of licenses at times. And the damage to institutional reputation has to be carefully dealt with. Legal obligations help ensure that the healthcare organizations operate effectively, ethically, and safely. At the same time, we have to navigate the complexity in international and crisis healthcare. So, emergency situations and settings, it becomes even more challenging for the people in healthcare to handle all this. So, in international healthcare and cross border services, where internationally they should know the national laws as well as differing healthcare standards in various countries, diverse ethical expectations across all the cultures, emergencies such as pandemics or natural disasters demand rapid responses while maintaining legal compliance. Cross-border provision of healthcare involves complexities in licensing, data sharing also, and adherence to the international ethical standards. These challenges highlight the need for healthcare professionals to possess legal awareness and to the ability to coordinate across the jurisdictions of the countries concerned. For example, during a pandemic, a non-profit organization may need to import a medical supplies across the borders, which requires compliance with custom regulations, import restrictions, and local healthcare approvals. So, data sharing between all the countries must follow privacy laws, and also at the same time, international agreements they have to be complied to avoid any breaches of contract and agreements between the countries. These legal hurdles may require proactive planning, legal counsel, and taking the help of experts from the legal field and intergovernmental coordination to ensure safe and effective service delivery is being given. So the global humanitarian aid relies on complex cross-border legal compliance. So donor origin, the where the medicines are coming from, where the people are coming from, even nowadays for tourism or medical tourism, where the patients are coming from. All medical donations must meet the WHO standards, quality standards, ensure proper labeling, temperature control, and the expiry dates. And the AmeriCares is organization in America must navigate strict import export regulations within America and the customs requirements. Gift in kind, if anybody is giving the gifts, then framework, then distributing emergency medical supplies, those have to be recorded thoroughly. Neutral aid delivery also, the Red Cross Society, for example, they have to understand the international humanitarian law, specifically the Geneva Conventions, which govern the healthcare workers and neutral aid activities during the armed conflicts between the countries. So, in order to know the differences between the countries, they should ensure that none of the legalities are forsaken in the due process. And to understand some of the case studies which is there in your syllabus, the first one is Mayo Clinic, which is having both care as well as a lot of research which they undertake. The operational law makes them tax exempt status requiring surplus reinvestment. So there are so many investors which deals with these kind of operational laws. There could be risk vectors like IRB compliance, and clinical trial data ethics. So wherever they are undertaking clinical trials, the data ethics have to be understood and followed up. Medicare billing has to be thoroughly uh, audited. At the same time, another organization like Feeding America, which handles mainly in the areas of nutrition and health, the operation law which acts upon these are Good Samaritan Food Donation Act, where it shields the donors from liability. So the donors who are donating liberally for Feeding America, they are covered under the Good Samaritan Food Donations Act, and there are risks which are ensured that has to be complied with the FDA of American Food Safety Standards and SNAP government reporting compliances. So several other things they have to be very critical about maintaining the standards. Then comes Catholic Charities. The faith it is a faith-based delivery. It has an operation law, which means to say that it has a focus on secular healthcare laws applied to religious contexts. So risk vector includes balancing the HIPAA regulations and licensing with strict faith-based mission principles. So diagnostic matrix involves various companies and various organizations to follow certain laws, and also there are risks involved which they have to be very aware about and balance with the ensuring standards. So, if Mayo Clinic has a model of legal excellence, it is because it is globally recognized as a non-profit organization that integrates the patient care, medical education, and research within a single institutional framework. As a non-profit entity, it does not operate for commercial profit. Instead, all surplus funds are reinvested for improving the healthcare outcomes, advancing the medical research, and supporting educational initiatives. Such large scale requires strict adherence to the healthcare laws, ethical standards, and non-profit organizations within the United States. Legal frameworks serves as a foundation for institutional accountability and patient safety and ethical governance. Understanding these legal requirements helps learners to appreciate the laws is not a restriction but a support mechanism that enables excellence in healthcare delivery. So people have to know it in order to fulfill the legal obligations. And then ethical research and patient protection, such as in Mayo Clinic, the medical research which is carried out in the Mayo Clinic is governed by strict ethical and legal frameworks designed to protect the human participants. Research proposals must undergo rigorous reviews and peer-to-peer reviews approved by institutions. They are having their own internal committees to ensure participant safety, that there is no harm in understanding the research. Clinical trial regulations govern how studies are conducted, how data is collected, and how findings are reported. Transparency requirements prevents conflicts of interest and unethical research practices. These laws enable institutions to innovate in medicine while safeguarding human rights and ethical standards and scientific integrity. So the mission-driven institutions sometimes have to navigate. There are overlapping legal jurisdictions across various countries. For example, in terms of governance, in which the Mayo Clinic is undertaking care as well as research, there are tax-exempt financial governance. People who are donating it, they also have to be protected. Similarly, with Feeding America, which takes care of the nutrition and safety of some meal schemes within America, they have to know the donor funds and transparent operations are underway, and same applies with the Catholic charities, faith-based services, mission-driven religious governance. So as far as governance is concerned, the core thing which they are focusing on are these areas. Key protections are institutional review board, IRB ethics, and the a thing which, as far as what is protections for Feeding America, is the Good Samaritan food donations, which shields the donors from liability, and then there are some tax exemptions as well. Then Catholic charities key protections are the First Amendment and faith-based exemptions. Then we have the primary legal friction points are also there, because the Mayo Clinic normally comes across balancing the clinical care with global medical research compliance. So they face in these areas, they have to be very compliant about the countries in which they operate. As far as Feeding America is concerned, it is the intersection of surplus nutritional contributions which are coming from various institutions, which who are heavily donating to Feeding America and complying with the food safety laws which are operating in their own countries. Then the Catholic charities navigating the intersection of religious principles with secular healthcare regulations and public funding. So they have to be having a thin line of discrimination in terms of understanding what the governance is standing for, what the key protections of act which are applicable in those organizations, and what the primary legal friction points may arise at various points of time during offering their services. At the same time, AI, when it has been coming before 2025, it was yet to be generative AI was just about to start. But as the time has gone within 1 year, there are some AI agent benchmarks because almost all the kinds of applications nowadays it is backed with AI. So the test models across 100 specialized disciplines are being done, where healthcare is one of such discipline. Although there are no much breakthroughs and accuracies which are yet to be explored because medical field is like that, which is taking a lot of time in order to get this activation curve. But proactive autonomous agents are there, whereby frontier models are developed to utilize the iterative reasoning and multi-step environmental interaction to handle expert level professional tasks. So whenever two to three organizations are coming together at national international level, there are expert level professional tasks which arise that has to be understood with the capability levels. So sometimes before 2025, it was just passive generative chats which was there, but nowadays people are asking deeply into what makes the lot of difference between the organizations. So agentic AI has been able to carve out what exactly is needed for certain group of organizations to make from the passive generative chat to a more proactive autonomic understanding of the scenarios, because as autonomous agents they are able to shift from just being compliant to ensure that it is going to help upcoming MOUs with various kind of organizations. Now, as far as feeding America is concerned, there are other issues like, for instance, traceability issues are there. Like as far as malnutrition and obesity are concerned, they are and chronic diseases within America related to heart and all. They have their own different set of problems. So what is happening is Feeding America is a leading non-profit organization dedicated to combat hunger and food insecurity across the United States. Food insecurity is closely linked to the health outcomes, whereby including malnutrition, chronic diseases, and developmental delays in children. So there are various complexities arising, like the children's are not growing properly and there are developmental issues amongst the children. As a non-profit organization, Feeding America not only has to have all the laws that they have to comply and to be ethically transparently ensure that the aid reaches the populations who are most in need. So legal regulations guide how the organization acquires this knowledge, stores and distributes the food, as well as guaranteeing the safety, quality, and fairness in all its programs. In order to do that, they may have to understand what food safety law, FDA laws are all, and whichever areas the food is grown or the farm where it is grown, the people or the children who are eating it, they should know where it is originating from which farm or which particular state it is originating from, what is the labeling, what kind of storage, what kind of handling it has undergone, what kind of distribution of food to prevent contamination, spoilage, or health hazards. So compliance ensures the donated food meets the nutrition and safety standards, protecting vulnerable populations from foodborne illnesses. It is to ensure the legal protections such as the Good Samaritan Food Donation Act in the United States shields the donors from and distributors from liability, encouraging surplus food contributors while maintaining safe practices. So healthcare and public nutrition regulations intersect. So people are not only ensure that public health is more important, but healthcare as well as meeting the safety laws are equally important, while understanding the Feeding America's work ethics, because nutrition directly affects the health outcomes. So nutritional assistance programs are guided by federal and state policies to ensure that the recipients receive adequate, balanced, and safe food, either through the childhood or through the midway into the high school or beyond. So collaboration with government programs like Supplemental Nutritional Assistance Program (SNAP) involves strict reporting and compliance to maintain the funding and program integrity. These legal frameworks ensure that the aid is both lawful and effective. Now, nowadays, as far as helping of AI is concerned, they are coming up with massive scale expert clusters. So Claude Mythos 5 is MOE architecture, in which the first publicly accessible 10 trillion parameter model is able to have the mixture of experts architecture. So, for the very first time, they have come up with an architecture known as a mixture of experts architecture, which is having a tiered attention. It maintains 4 million token context windows with dedicated experts cluster for advanced academic research synthesis and cybersecurity. This assures that lot of understanding between the humans and the data which they are being able to send. There is a diverse unification of reasoning, and frontier AI matrices are being utilized to a certain extent, at least in some growing economies as well as emerging economies, which makes the complex structure more simplified over a period of time, as has happened in some of the developed countries. And the deep research agent flow allows that despite the high benchmark, unharassed AI agents experience that 97.5% of failure rate, including multi-step real-world tasks. So what is happening is they are asking about the deep research capability. They are finding various tools and data retrieval and self-verification loops. And finally, the data is interchanged between various organizations and final synthesis is drawn. So there is a lot of chance that agentic reliability requires robust structural harness to prevent critical failures. So they are able to support the entire mechanism by doing agentic AI so that they can overcome the critical failures as and when it is happening at various places. Now, coming back to our basic understanding of healthcare providers of the NGO, the faith-based services in the legal framework, which is going to help us understand Catholic Charities USA, being a non-profit organization, is involved in social services, community support across the United States while guided by religious principles. The organizations must comply with secular health laws to ensure safe, equitable, and legal service delivery. So, while understanding these legal frameworks allow the faith-based organizations to uphold their mission while adhering to the national and state regulations governing healthcare provisions, data privacy, and patient rights. So, understanding these laws is essential for the learners to appreciate how ethical and lawful operations intersect in the faith-based healthcare. And apart from that, balancing the faith and legal compliance is a critical juncture at which they intersect. So, legal challenges arise for faith based organizations when religious beliefs are intersecting with the secular healthcare laws. So, for example, there may be restrictions on certain treatments or procedures that conflict with the religious principles. Organizations must navigate these challenges carefully, ensuring compliance with legal requirements while upholding their faith based mission. So, emergency healthcare delivery, public funding, and partnership with government agencies also introduce legal complexities that require careful planning and adherence to laws. So, entire legal system, which is very slow in India, makes us difficult to understand at what level they are operating on. But at the same time, NGOs which are involved in this makes us to know at what level the complexities are there in order to decide between what steps they have to ensure for the legal upholding their legal requirements and also their faith-based missions. And the case study about the Red Cross Society, which has been there since World Wars One and Two, the role of law in emergency medicine and humanitarian aid is about the global humanitarian organization that provides emergency healthcare, disaster relief, and crisis support worldwide. Its operates are governed. I mean, its operations are governed not only by the national laws but also by international humanitarian law, particularly the Geneva Conventions, which protects the patients, healthcare workers, and neutral aid activities during conflicts. Legal frameworks also ensure that the emergency healthcare is delivered safely, ethically, and in compliance with both domestic and international regulations. Understanding these laws is essential for learners to appreciate the complexities of humanitarian healthcare and role of legal compliance in life-saving operations. So, Red Cross has been doing a lot of work in charity and has to not only follow the strict adherence to licensing as well as regulatory standards, but also the certifications are given even under crisis conditions. Medical personnel must properly be trained and credentialed, and facilities or temporary shelters must meet safety requirements. Compliance with local and national health regulations show that the aid does not inadvertently cause harm, and the patient needs minimum medical standards which they have to meet. Legal oversight also governs the use of public funds, donations, and medical supplies, ensuring accountability and transparency during the relief operations. So, patient rights have to be maintained even during emergencies. Informed consent, confidentiality, and equitable treatment must be maintained wherever possible. International humanitarian law mandates that healthcare can be provided without discrimination based on race, religion, nationality, and political affiliation. These regulations help safeguard human dignity and prevent ethical violations during the relief efforts. Now, why legal compliance matters in healthcare is we have to understand what drives their quality and sustainability. In order to assure that the quality is driven on a long term basis, we have to ensure that it has to be seen from various perspectives, both legal and technical. So the trustworthy AI is the new upcoming thing, and there's a trending thing which is happening, which quantifies the governance models in which it ensures that fairness and safety is maintained at all levels. In the first place, the regulatory genome is an adaptive framework that continuously aligns AI with innovations in ethical compliance and privacy protections for sustainable development goals, which is the impact of outcomes, which it shows on the y-axis. On the x-axis, it is the ease of integration, which is happening across all the apps. So they have to know that what is reliable and what is explainable AI is about the core outcome from which it has an external origin of the attributes of the environment which it measures, and the helpful in achieving the objective, which is the ease of integration which is achieved. So the trustworthy AI is the core outcome from which they can be made not only sustainable but scalable and trustworthy. So represent efforts within the organizations to ensure that scalability and sustainability and trustworthy AI systems are being integrated for the core outcome. And then we have the fair, accountable, and bias free AI, in which focuses on internal origin from where this kind of services are improved, and AI integration in impact and fairness and accountability and outcomes are also being driving these kind of outcomes. So the secure, compliant, focused AI is something what every organization wants but cannot afford as of now until it is heavily invested, because an NGO cannot do all this on its own. So highlights challenges like regulatory gaps, non-compliance, and privacy risks that can obstruct the AI's secure and in ethical integration. So the black box, what we finally come across all these understanding of the trustworthy AI is the black box nature of the deep learning systems hinders the clinical adoption. So clinical adoption is being hindered and is not easily understood by people. Impact assessment metrics must evaluate algorithmic transparency and human in the loop oversight and energy consumption. So people are saying there will be time when a lot of things, even at the charity level, are being integrated for the betterment of the impact of outcomes as well as the ease of integration, while sidelining the harmful effects. So harmful to achieve the objective are also happening, which has got its own impact as a sideline. So all these issues have to be fairly balanced while integrating the newer technologies into the medical care. So what we have understood is the quality and sustainability of healthcare comes from various perspectives. It comes because compliance reduces the risk of litigation. People should not face unnecessarily legal hurdles. They should not face financial losses, and it should not be reputationally damaging for any organization while strengthening the public trust in healthcare organizations. It supports ethical decision making and reinforces governance structures, particularly for non-profit organizations that rely on the donor confidence. Because most of the NGOs are reliant upon all the donors and the heavy donations on which they survive. Overall, understanding and adhering to the healthcare laws ensures safe, ethical, and higher quality care for all the patients. From the Mayo Clinic's research integrity to Feeding America's food safety protocols and the Red Cross emergency response to the AmeriCare's global aid, legal compliance is not a burden. Okay, it is a foundation, and in order to understand this foundation in real depth, there is a lot of research being done, and it enables organizations to operate with transparency, accountability, and responsibility. And trustworthiness is ensured in non-profit organizations, international and emergency settings. Legal frameworks set as enablers of innovation and trust and long-term sustainability. Learners can see that law is not a restriction but a support mechanism that enables excellence in healthcare delivery. By integrating legal awareness into daily operations, healthcare providers and organizations can deliver better outcomes and protect the vulnerable populations and build resilient systems for the future. So, as far as the bias is concerned, we'll go that, especially in the low and middle income countries, whereby this kind of a thing is quite uncommon to see. A BMJ health study, one of the studies which had taken, revealed that only 35% of editorial board members, those who are carrying out the research and all this, across 12 major global healthcare journals, are female, and only 33% are based in low and middle income countries. So that leaves the entire thing of 35% board members and 33% are in from the low medium income countries. Only the most advanced countries are able to understand what this research is going to be like. So, group one, editors in chief, those who are publishing all these things, they show that 59% over here are males, rest of them females. So 8% and 4% high income level and low and middle income countries are lesser. So here, group two, senior and deputy associate editors, 43% males, and here you can see only 22%, and here it is 12%. Okay, so we are able to know that the males from the developed countries are occupying higher levels, even in senior and deputy associate levels. Group 3, editorial boards and advisory boards, 41% are males, whereas from the lower income countries, LMICs, males, we are having around 11. This one, I think 23. Yeah. So we see this is how it is unequal. So when the AI to understand how much of research has undergone in order to implement various global health studies, when AI models are trained on academic literature to understand the lack of the, I mean, we are coming up with lacking the diverse geographic and demographic representations across various countries and communities. So their diagnostic and policy outputs inherently are disadvantages for the marginalized population. So their samples have to be given prominence as we go ahead. So more and more people have to undertake that they are going to do it for their own country's development where it is locally be available for them rather than seeing it from the Western perspective. Now, as far as patient safety is concerned, it is a unified discipline across physical, international, and digital realms. So, on one hand, you have got humanitarian treaties, which we have just now saw, be it Red Cross, be it Feeding America or Mayo Clinic, the neutral protection of vulnerable populations has been made mandated by the Geneva Conventions. But I am not sure how far the Geneva Conventions have been adopted by European countries and whether it has been done in America seriously. Because the Geneva Conventions directly parallels the algorithm fairness. So, as far as what we have seen, how much of research has been undertaken, we have already seen from low and middle income countries there have been lesser representation from female populations. However, the AI regulatory genome, whether protected by legal compliance officer, humanitarian volunteer, or an AI harness engineer, the architecture of trust relies on absolute accountability. So it takes time in order to become absolutely essential because it takes a lot of investment from both the organizations, and in order to become accountable and fair, there's a lot of time we have to ensure that the domestic laws, whereby especially where the legal system is slow, there are a lot of things on the legal front when there are a lot of cases pending against various organizations, either by the patients or by various NGOs. These informed consent laws of hospitals share the exact same ethical DNA as the transparency requirements of trustworthy AI framework. So, as and when we come across these kind of challenges, patient safety is not only to be seen from the limited lens of local laws, but also across international and digital realms, which is changing at a even different magnitude. So we have to know the regulatory genome on one hand, the domestic laws on the other hand, and the humanitarian treaties across various countries which have evolved over a period of time, much before the AI has been able to uncover all these possibilities of ensuring transparency, accountability, and fairness. So let's try to see one question. Which legal framework specifically shields the donors and distributors from the liability to encourage surplus nutritional contribution in the United States? A. The Good Samaritan Food Donation Act. B. The World Health Organization Quality Mandate. C. The Geneva Convention. D. The Institutional Review Board exception. Anyone trying to answer? A. So, right. A is the correct answer which you are given. It's the Good Samaritan Food Donation Act. So, explanation is the Good Samaritan Food Donation Act provides vital legal protections that shields the donors and organizations like Feeding America from liability, provided the food is donated in good faith, ensuring that essential nutritional aid reaches the vulnerable populations safely. Second question: what groundbreaking capability allows the GPT 5.4 model to to natively operate desktop applications and navigate browsers with an accuracy that exceeds human expert testers? Tired attention architecture, native computer use, mixture of experts, the regulatory genome. Let's see the answer directly. The person who says native computer use. Is it correct? The ChatGPT 5.4 integrates the native computer use capabilities directly into its unified architecture, its, uh, allowing it to issue mouse and keyboard commands and visually observe a desktop environment, scoring 75% on the operating system world compared to the 72.4% human baseline. Native computer use. According to the BMJ Health Survey or the study, what percentage of senior leadership roles on editorial boards are held by women based in low and middle income countries? We are already the correct answer is given here. It's 4%. So final takeaway is very few female populations from the low and middle income countries have been doing a lot of good research on this. So building trustworthy AI in 2026 require dismantling the structural biases of the past. We cannot code an equitable future using data which excludes the global majority. So, in order to understand this, we should be able to go further, both technically as well as at the NGO level, in order to do what is driving this kind of percentages in leadership roles. Now, coming to foundations of community health, legal and ethical framework for community health and welfare programs. So, legal and ethical foundations of community is the second topic. So we have seen at the global level now, at the welfare level, these frameworks ensure that services are delivered safely, fairly, transparently. Legal structures define the boundaries. Legal structures are also not only defining, including registrations, tax, labor laws, regulatory adherence, but ethical principles like decision making, ensuring equity, confidentiality, respect for vulnerable populations. Both legal and ethical standards are interdependent. Without legal compliance, program risk the legal penalties and loss of credibility. Without ethics, programs may perpetuate harm or inequality. A strong framework fosters trust among beneficiaries, donors, regulators. So trust is what is most important for all the stakeholders, beneficiaries, donors, regulators, creating sustainable and impactful community programs. Though, so one more example is the United Way. So United Way operates in around 40 countries, adapting its community health and welfare programs to meet local needs while complying the national laws. Its mission-driven non-profit model ensures that all resources are reinvested back into the community welfare programs. The organizations partners with the governments, healthcare providers, and NGOs to deliver preventive care. Then they handle the chronic disease management and social support programs as well. So this is another organization as an example. And the welfare compliance which they have include financial aid at sometimes wherever there's distress. They come up with food security and housing support also for the underprivileged populations. There are huge donations. These initiatives require strict adherence to anti-fraud measures because under the garb of doing all this, there are people fraudsters who do different sorts of things. So in order to know, there should be proper documentation and privacy laws to ensure fairness and transparency. Donor trust is maintained through rigorous oversight and accountability mechanisms. Then comes the community health compliance. Healthcare programs such as the preventive care and chronic disease management must follow licensing, reporting, and safety standards. Partnership with licensed providers ensure the safe and legally compliant service delivery. So, welfare programs and community health compliances have to ensure that whatever purpose with goals, mission, and vision which the company like United Way has started, that has to be adhered strictly wherever they are reaching the right populations and not go into the hands of wrong people. Then comes the YMCA program, the liability and the data protection in wellness program. So a YMCA is a Young Men Christian Association which is started long back, and they undertake wellness activities and they require liability insurance signed consent forms, and their staff are, are having CPR certifications. They also undertake emergency response systems. They do a lot of participant data gathering, and they are protected under HI, Health Insurance Portability and Accountability Act of 1996 in America. It is a US federal law designed to protect sensitive patient health information from being disclosed without consent. So, HIPAA of the US Act, and they are undertaking cardiopulmonary resuscitation. So, they are saving lives, and they are doing a lot of things in order to ensure that the vulnerable populations do not face distress. So, the GDPR, that is the General Data Protection Regulation, which is a comprehensive European law which was effective from May 25, 2018. So, these are some of the acts which they have to follow, and they have to regulate these wherever, especially in the EU as well as the US countries where they are mainly operating in, and of course in any country which they are operating in. The historical background is way back in 1844, YMCA promotes youth and development and community support worldwide. And later on, there is one more organization known as the Salvation Army. So, the Salvation Army started way back in 1865 to provide the social aid and spiritual guidance through practical services. So, Salvation Army founding and objectives are there. So, both YMCA and Salvation Army, they are having from 1844 and 1865. They've got a long history in order to take care of certain areas where people were facing distress. The organization structure and funding, both organizations have hierarchical leaderships. They ensure that effective management is done. Local chapter autonomies are there, and there are circles and various groups within which they are having leadership models. And the sources of funding and financial management, they also are helped with certain governmental assistance and fundraising initiatives and managed with a lot of transparency. So the healthcare initiatives, which in case of YMCA wellness programs, are aimed at improvising the physical and mental health through community fitness and nutrition education and preventive care. As well as Salvation Army, when it comes to this, it handles the medical and emergency services, which provides the critical and medical aid and emergency response in disaster zones and underserved communities worldwide. So, while doing all this, they have to comply with certain regulations, which become challenging, especially if they are funded less. But they are in certain countries they are funded more, in certain countries they are funded less. They should comply along with ethics, staff responsibilities, and healthcare compliances. The social impact and community development, YMCA educational and health empowerment, offering the educational support and leadership training and skill building activities to nurture the youth potential. Implementing in the case of Salvation Army, they are having to literally take care of how to alleviate poverty and rehabilitate the people. Then implementing support services like the shelter, food, and vocational training to help individuals regain the independence and become free from diseases. Next comes the Bill and Melinda Gates Foundation, Global Healthcare and Risk Control, which is about the global philanthropy and the regulatory compliance by Bill and Melinda Gates. So, the Bill and Melinda Gates Foundation funds global health initiatives targeting the infectious diseases, maternal and child health, and vaccine distribution. It operates under the strict compliance with international standards such as the WHO, that is the World Health Organization, and FDA for the distribution of Food and Drug Administration of the US, and EMA regulations to ensure the safety and equity. So, despite A lot of challenges which the couple have fought, but still they are doing a lot of philanthropy for the general public in across various countries. The Bill and Melinda Gates Foundation, risk management and ethical integrity in global programs. So, regulatory compliance in global health. Ethical considerations should include informed consent, equitable access, and foundations of vulnerable populations. The foundation avoids the conflicts of interest and maintains transparency in funding research decisions to build trust with communities and donors. Ethical governance and philosophy. So all medical donations and research activities also side by side. It's not only medical donations, but research activities must follow intellectual property rights, that is IP right, that such as your patents, copyrights, and trademark agreement, research ethics, and cross-border trade laws. For proper valuation and documentation are required for tax deductions and compliance reporting. Key lessons which we have learned for sustainable and compliant ethical community health programs are: one, strong governance with fiduciary board responsibilities ensures accountability of all the organizations concerned. So there should be strong governance. Point number one. Point number two, compliance with healthcare label and data laws prevent legal penalties and builds donor trust. So those who are really helping others should be trusted. Ethical principles such as equity, confidentiality, and non-discrimination fosters community trust. Partnerships must be legally structured with clear rules and risk sharing. Proactive risk assessment, insurance, and documentation reduce the liability exposure. These elements together create resilient, transparent, and impactful programs that serve the vulnerable populations effectively. Now, coming to legal compliance in healthcare regarding funding, partnerships, taxation, employment, and future risks. Philanthropic funding, which I just now saw, it is for not only for hospitals, also for research and preventive healthcare units and the betterment of community health programs. So donors, including foundations such as the NGO and private individuals, contribute heavily the resources that are vital for the sustainable healthcare delivery. Legal compliance ensures that these funds are used transparently and ethically for their intended purposes. Without proper compliance, there is a higher risk of financial penalties, legal actions, and reputational damage. So compliance builds trust among donors, beneficiaries, and regulatory bodies, reinforcing accountability and integrity in the fund utilization. Effective governance and oversight are critical to maintain public confidence in philanthropic healthcare initiatives. Ensuring transparency in philanthropy funding, funds flow from the donors to healthcare providers through structured, auditable channels. Each step ensures legal and ethical review to ensure alignment with donor conditions and regulatory standards, balancing compliance and ethical standards. So, regulatory compliance on one hand requires strict adherence to local health and labor laws as well as safety regulations. Donors often impose specific conditions. Donors are also interested to impose their own conditions on fund use, how they have to be utilized, for what purpose they are donating, and which must be legally documented also. So, something which has been coming as a money should not be siphoned off for some other purpose. Ethical governance, like organizations must comply with tax laws, charitable status regulations, and donor specific conditions. Grant agreements often include clauses on fund use and reporting and accountability. Monitoring accountability in fund management. Regular audits, financial reporting, and compliance reviews are essential to ensure funds are used appropriately. These processes help detect misuse and prevent fraud and maintain donor trust. Staff training and clear documentation support consistent compliance across all the departments. So, ethics of care is nothing but balancing equity and efficiency in healthcare. So the four pillars of healthcare ethics which you are able to see is: one is justice and equity, ensuring fair distribution of resources or equal treatment regardless of status or location; beneficence and non-malfeasance. Okay, so acting in the patient's best interest while proactively avoiding physical and emotional financial harm to those who are undergoing these kind of treatments. There should also be autonomy and informed consent. Respecting the patient's right is to make informed decisions about their own medical treatment. So the four pillars of healthcare also involve strategic frameworks at the organizational level later on. So efficiency versus equity is for the organizations to decide how much efficient it could be, whereas how much equity it can maintain. So balancing cost effectiveness, maximizing total healthcare benefits, and fairness, prioritizing the worst of needs-based prioritization. So allocating the scarce resources like ICU beds based on medical urgency rather than social status. And then transparency and accountability, maintaining trust by ensuring all allocation decisions are justified and open to all the stakeholders. So we have the humanitarian healthcare focus, healthcare access, essential to the underserved and rural communities, especially emergency response system should be ready with rapid deployment of resources during the triage, during the disasters. And then health education, which empowers communities with knowledge to prevent disease and improve the literacy. So, ethics of healthcare is all about equity and efficiency, maintaining the four pillars in healthcare ethics: justice, equity, beneficence, and non-maleficence, and autonomy and informed consent. And international regulatory complexities like WHO standards, or some people give gifts. So, medical donations must meet rigorous quality threshold. Just because somebody is giving free of charge, that doesn't mean that it goes without any kind of standard. So legal imperative prohibition of expired and substandard items are also sometimes given. So they should know who is giving what. Strict compliance with import and export regulations also to be monitored carefully. Next comes the Geneva Convention, the Red Cross. So in this case, patient rights must be protected even in conflict zones. So all the patients, wherever the conflict is happening, there the Red Cross is operating. Healthcare delivery is strictly based without the race, religion, or nationality issues or political affiliations. Then comes the sovereign health jurisdictions. So it has the cross-border, it requires local licensure. The legal imperative is navigating different custom regulations in different countries and data sharing laws simultaneously. They have to handle such a huge complex data with which they should be very compliant, and basically informed decision has to be taken within the given context. Then healthcare partnerships, legal considerations. Now, joint ventures happen and shared infrastructure, clear ownership models are there. Research collaborations also should define the intellectual property rights and data ownership. Public private partnerships, demand alignment on funding, governance, and service delivery. So, strategic alliances on knowledge transfer and training has to happen. This public and private entities should come together. They should have to have the legally binding agreements that outlines the roles, responsibilities, and compliance obligations. Without proper legal structure, partnerships risk operational failure and liability disputes on regulatory breaches. So the legal agreement has to be the backbone. The newer architecture with the machine or algorithms, they maintain that the partnerships agreements must include clauses. They have to come up with policies, procedures, guidelines, and practices which have data ownership. Who is the owner of the data with the organization, the doctor, the researcher, or some investor or the stakeholders. So who is the data ownership? Then what kind of confidentiality clauses they have to include? What kind of dispute resolution they can come up with at which kind of courts? And then compliances with healthcare laws and ethics. Then comes ensuring fair and transparent partnerships, regulatory compliance, dispute resolutions mechanisms such as arbitration or mediation are essential to manage these kind of conflicts without legal escalation. Another thing is ethical conduct. All partnerships must comply with labor, licensing, and patient safety laws. International projects must follow the foreign exchange and customs regulations. Mastering the dual operating healthcare. On one hand, they have got the human operating systems, so you've got the machine operating systems. On one hand, you are having the governance issues, obviously, and on the another hand, you got autonomy, which the machine is giving you. So, in case of the human operating system, you've got the architecture of the treaties, the old style domestic laws, the non-profit ethics, the enforcement, including WHO standards, Geneva Conventions, and FD and IRB. Pacing is delivered because of deliberate interventions, precedent driven mechanisms, what happened previously, and geographically bounded. So, this is how the earlier systems have been. And now, slowly over to the machine operating systems, which ensures there's a lot of autonomy, is based upon the 10 trillion parameter mixture of experts, deep research frameworks. Enforcement can be about harnessing engineering and helping us with the model context protocols with explainable AI models. And pacing is instantaneous with iterative and borderless execution. Now, the 2026 is not choosing between systems, but building the secure APIs, trustworthy AI, and that allow them to communicate between various organizations at their respective levels. Now, coming to the non Profit healthcare laws and operational practice. Non-profit healthcare organizations must comply with the tax exempt status laws, patient privacy regulations, and labor standards and accreditation requirements. These laws ensure the non-commercial nature of the organization while maintaining accountability. So some of them are operating commercially. People have to have the due diligence in order to differentiate between what is commercial, what is NGO, and how to come to have a bridging policy that ensures that practices requires clear operational guidelines, staff training, and regular audits to ensure the compliance in daily operations. The 2026 Healthcare Synthesis helps us to understand the human legal framework with autonomous machine intelligence. So then coming up, we are having the mixture of experts, the unified architecture. It has the rose coding, reasoning, and vision into one model. And you've got Claude Mythos 5 is also coming with first publicly accessible. Anybody can access this 10 trillion parameter model. Mixture of experts with dynamic routing and 1 trillion parameters active path. So you have to know the deep domain expertise. People who already have the knowledge, they can try to attain the lot of understanding with academic research and complex software engineering. Next comes deep research. So the mechanics of iterative intelligence, whatever input you are giving, based upon that, it will generate probability-based word prediction, the key long tail keywords and the short tail keywords, instantaneous output, and it has a high hallucination risk. So while doing all this, what we are trying to understand is deep research, agentic workflow, whatever input is being given with a 30-minute loop, then it is able to generate an output with a structure which shows what is cited and who has cited, what kind of research has been carried out at various places across the globe. It generates a report with inline metadata. And while giving metadata, it comes up with its own clarification and planning, expanding the user front with immediate models. It comes up with context protocol. It comes at rules and regulations why it has done it. It gives a reason as to why a private organizational data has been kept safely and why it has not been disclosed, whether it is purchased or not purchased, whether it is free or open access. And then it comes with execution. It will deliver us web search and lists all the file search and code interpreter tools that deployed simultaneously. And then comes with multi-source verification, in which cross-referencing 25 plus parent sources from where it is extracting the research carried out for the benefit of all the organizations concerned. So it is a large language model which a deep research undertakes for people who are going ahead beyond the MBA into the PhD levels for iterative intelligence, in which it will try to understand in what context what organizations are able to operate. If deeper dive will tell you the case studies and the best cases thereof, and the legal compliance of workforce management we have just now able to see that it is very high risk prone environment like laboratories and operating rooms, in which anti discrimination laws ensure that fair hiring is possible and promotion is given to respective people. Employee benefits such as health insurance and paid leaves are legally mandated. International operations must comply with the global labor standards, and non-compliance can lead to what? Lawsuits, fines, and reputational harm. So clear policies, training, and regular audits are essential to maintain a safe and compliant workforce. Creating a fair and safe work environment is something what is the basis of leading a better life in the healthcare. That speaks sometimes about harassment, many a times about violence, and also dealing with grievance redressal procedures are which are legally required and must be communicated clearly to all the employees concerned. Then we have got a trustworthy operating the clinical box. Now coming with explainable AI. The deep learning provides superior predictive power but lacks transparency. It has a power, it will give a data, but it lacks transparency. So we have to dig deeply down in order to know the explainable AI models. Mechanisms such as yes, happily addictive explanations. So determine the exact weight and contributions of individual patient features. Okay, why the decision has been taken by the machine, why the clinical recommendations have been given by the AI, and what is the AI's final diagnosis, what is the doctor's final analysis, what kind of human intervention is required in order to do under what conditions it will give, the context it will generate. LIME means local interpretable model agnostic explanations. Okay, so the same thing what is true in US may not be same thing in India. What is held right in India may not be useful in Africa. What is there in Africa may not be applicable in Australia. So it has to be local, interpretable, model agnostic explanation creates local simplified model around the specific predictions to explain the complex model behavior in human terms. So human is something which cannot be easily understood. Point number one. And point number two is the result which the machine is giving you. AI output becomes auditable, and the organization must ensure that it is auditable. The judgment is not done simply either too much bent towards some humanitarian funding basis, nor because it is going to naturally naturally comply with the laws of the other nations, but it should satisfy both clinical safety standards and legal liability frameworks. So balancing the legal obligations and the employee well-being is the local challenge which we have right now. So what is that legal obligation? What we have to follow and what should be the employee well-being? Point number one: workplace safety. So confidentiality and patient safety laws must be strictly enforced. To protect sensitive health information is not just going here and there. Employee rights, safety regulations prevent occupational hazards such as exposure to infectious agents, chemical spills, or equipment failure. So, on one hand, you have got the challenge of employee rights, on the other hand, you have to ensure the workplace safety happens. Now, despite all this, it may look very something annoying at times, but then yes, 97.5 failure rate is there despite all this. So despite scoring more than 85% on controlled academic benchmarks, whatever research has been happening since now, autonomous agents completed only 2.5% of the real world ambiguous freelance tasks to a client acceptable standard. Why? Because people are not yet fully harnessing this. The solution is to harness the developments happening in another sector. So, harness engineering models cannot operate naked in healthcare or law. They require a production harness focusing on self verification loops, that is, forcing agents to check outputs against the original constraints, and loop detection, breaking doom loops where agents endlessly repeat the errors. So loop detection has to be done, self-verification loops have to be understood, and durable state management, that is maintaining the logic. Okay. So maintaining logic even if context windows are reset. So this is the reliability paradox. How far it can become reliable on these kind of agents? Why agents fail in generating information which is applicable at most of the places, and still it is tilted towards those who are generating the information, and half of the people who are facing the problems are not generating the information because still a lot of things of investment and other training is underway. The conclusion is all about building a resilient and compliant healthcare future. So it will take a lot of time in order to know this. However, one, measuring the true reasoning; two, mitigating algorithmic bias; three, understanding the sovereign AI frameworks, whether it is EU or any other country. They have to deploy the local data residency laws. Physical AI and localized infrastructure ensures compliance with sovereign health jurisdictions. So, all this takes a lot of time for those who are understanding cross disciplinary expert knowledge, and representation in training data is strictly based upon medical ethics and requirement, not just a technical optimization in which they are feeding the data. So we have to know how legality affects the algorithmic bias here. So on one hand, you've got algorithmic bias which have to be mitigated. On another hand, sovereign AI frameworks are coming up, and where it has to match the true reasoning in which human judgment, humanity's last exam test, cross disciplinary expert knowledge. So more and more experts, mixture of experts are coming in a way in order to ensure that a lot of things are interconnected. So we are having a few last set of questions, curriculum capstone assessment of about humanitarian compliance and the 2026 AI landscape. One, domestic legal frameworks. Feeding America relies heavily on which specific legal framework to shield the donors and distributors from liability when contributing surplus food. Let's try to understand. Those who are answering B, I suppose they should be the ones. A, the Philanthropy Tax Transparency Act. B, the Good Samaritan Food Donation Act. C, the Medicare Surplus Compliance Code. And D, the National Healthcare Privacy Protocol. B is the correct answer. The B is the Good Samaritan. This specific legal protection ensures the surplus food contributions is shielding the donors from liability and ensuring vulnerable populations receive the aid while maintaining the safe practices. Second one, international humanitarian law. So, under the international humanitarian law, particularly the Geneva Conventions, emergency healthcare provided by organizations like the Red Cross must be delivered A, with priority given to citizens of the host nation over displaced persons. Two, exclusively using medical supplies manufactured to WHO standards. C, without discrimination based on race, religion, nationality, or political affiliation. D, only after establishing formal licensing agreements with the local government. Let's try to understand. D. Okay. What it says is that the Geneva Conventions protects patient workers and neutral aid activities during conflicts, strictly mandating that the healthcare be provided equitably and without prejudice to safeguard the human dignity so that this is maintained. What is this? Without discrimination based on race, religion, nationality, and political affiliation. So that is what it is. International humanitarian law.
But in the case study, it is mentioned as the role of law in emergency medicine and humanitarian aid, example Red Cross and Geneva Convention. So according to that, it is used exclusively using medical supplies.
No,
Is
but
it?
they are operating under conflict zones, na. So under the context, one has to study that. The very purpose of their charity goes off if they start only relying on the medical supplies as per WHO standards. Obviously, the medical supplies have to comply with WHO standards. That's another part. But that, the question. Let me get back to the question. What the question is: under international humanitarian law, particularly the Geneva Conventions, emergency healthcare. This is about only the question was specifically related to the emergency healthcare provided by organizations like the Red Cross must be delivered A with priority to citizens of the host nation or displaced persons. B exclusively using medical supplies manufactured to WHO standards, which anyway they have to comply with. I mean, I'm not saying that just because they are following this non-discrimination that they should not follow WHO or something like that. They have to follow for medical supplies. They have to follow the WHO standards, but as far as emergency healthcare provided in conflict zone, especially the Red Cross is working in conflict zones, they will not discriminate that you are from a separate race or you are from a separate religion or nationality or political affiliation. So international humanitarian law, the very purpose of it has to come up with some kind of understanding that they have to protect the patients and workers in neutral activities during conflicts, especially. Okay, and strictly mandating the healthcare be provided equitably and without prejudice to the safeguarding of the human dignity, because all are humans. So race, religion, nationality, and political affiliation should not come in the way of giving them the human treatment. So then comes the 2026 AI landscape. What architectural design allows the Anthropic's Claude? So whatever latest wars you are seeing between America and Iran, it was done through the Anthropic Claude. But now on on the betterment of health side also. So Anthropic Claude's Mythos 5 possesses 10 trillion parameter capacity while maintaining the computational cost of 1 trillion parameter dense model. So, what architecture design is used? Is it a native computer use functionality that offloads processing to local hardware, or is it a mixture of experts architecture with dynamic routing, or is it remote model context (MCP) for external data, or is it a tool search mechanism that reduces the token usage by 47%? Let's try to see the answer. It's a mixture of experts architecture with dynamic routing. So the mixture of experts architecture utilizes sparse activation, meaning only a fraction of the total parameters, roughly 800 billion to 1.2 trillion, are active for any given token during a forward pass. So it undergoes all these things in order to know the changing landscape, whereby Anthropic Claude is able to direct you to take certain actions based upon the generation of recommendations. It asks you with one or two or three choices to make. So AI landscape has been separately changing in Anthropic Claude Mythos 5. Okay, so this Mythos 5 is being utilized at various places. Of course, it's a long way to go for medical ethic. I mean, medical population to come up with, especially in the Indian context. Then, fourth, agentic architecture. Unlike standard instantaneous large language model requests, OpenAI's deep research models optimize for complex analytical tasks by skipping multi-source verification to minimize the interference latency, disabling external tool to use to preserve 1 million token context window, utilizing an iterative multi-step search and reasoning loop taking 5 to 30 minutes, or relying entirely on pre-trained internal knowledge to prevent web hallucination. Okay, let's try to see that. C, utilizing an iterative multi-step search and reasoning loop which takes 5 to 30 minutes. So in which explanation is deep research trades instantaneous output for high reliability using reinforcement learning. Okay, it uses reinforcement learning to autonomously plan sub questions and browse hundreds of pages and cross verifies the findings. And trustworthy AI, that is explainable AI, are also the newer, the category of AI. Explainable AI techniques such as SHAP and LIME are primarily implemented in healthcare to address which specific challenge with the healthcare is facing. A, lack of interpretability in deep learning and neural network architecture. B, the high computational cost and latency of symbolic AI models. C, the difficulty of navigating varying custom laws of medical donations. D, the inability of agents to access remote model context protocol servers. Let's try to see the answer. A, it is the lack of interpretability in deep learning and neural networks architecture. So explanation is, while deep learning models offer superior predictive power, they have superior predictive power. Their black box nature fails healthcare's transparency requirements. Okay, so they fail in healthcare transparency requirements. The explainable AI techniques bridge this gap by revealing how individual features influence the clinical predictions. So we cannot blindly deep on this because a lot of interpretation still remains. The lack of interpretability in deep learning is remaining, which the human element of the humans themselves have to do this because it has a lot of information, sometimes mind-boggling information. But the person who is taking a decision should be well informed to take something which is more conducive in the local context and more human, as well as more practical enough to come up with this kind of recommendations, which the trustworthy AI integration does. So, anyway, I've taken a lot of time, 15 minutes more than what is allotted. Hope you have made the most of what has been happening around. Any other questions apart from this? Okay, thank you so much for being interactive. Thanks.